falling was something like second nature to me. I would do something in a hurry and fall. Just like that, suddenly one day my hand was not working the right side and I got scared. So I immediately picked up the phone and I talked to Dr. Prashant and I told him, this is what is happening, just leave what you're doing and come immediately, he said. So I went over there to the specialist, the now specialist. MRI was supposed to be about 7,000. So he just sliced that off and he said, you go immediately there. If you didn't bring money also, no problem, you just tell them my name. So in that way, I felt he was like one in our family. And at times I tell him, God must have you to help us always, not only with me, with every needy patient. And he is a gem of a man. I've never seen him angry, but gem of a person. And he treats us like his own people, own members of the family. That's the thing. He was very calm, cool, and I saw it on the video. So I said, this is the person who's needed for this hospital. And everybody feel comfortable when they come here. I've seen many doctors, and not praising this man, but he's just that.
But he's firm and she went taking him for a checkup. Lift your leg. She told, lift the leg. You're not sick. Lift. That's what you should do.
I was shocked.
He's the right man for you.
I was shocked at that time. I've never heard him raise his voice, And he said, just lift the leg. I'm asking you to lift your leg. I cannot, I said.
But you did that, you lifted?
No.
Yes, you held your leg, your thing, took out your socks, then you put your leg down.
I never trusted anybody else, but Dr. Prashant, I trust him like he's my very own, like that. Even Bianca will tell me, Mommy, he's a doctor and you're just casually talking like this, and he'll say, just keep quiet, let her talk. Titanium rod he put, and he told me it's a very strong metal, so you have to be careful now. And I was telling him, I want to walk back again. He said, I want to see you walking into my clinic. I don't want to see you having any attachments and, any aids to help you walk. He sorted it all out. Until now, I don't feel any pain or any discomfort. There's no such reaction to what he has done.
So I see a lot of old patients who come with fall from at home and slip and fall. And in a week I get about at least 3 to 4 patients per week with hip fractures of the leg, and they are a bit of difficult candidates to operate because the bones are fragile and the healing takes a long time, and I can't keep all old people in the bed for long, because if we keep them for long, then bed sores, lung infections, urinary tract infections. So that's the reason why with whatever age we always tell them to get the surgery done. And this patient, Mrs. De Monte, who came to me with history of fall, she's a very heavily built patient, and she came to the ER with fracture of the hip joint and what we call trochanter. That's the most common fracture at this age, and I had to face a lot of problems. One is with her age, next is bone quality, next one is diabetes, hypertension, and one more thing is what she had, a DVT, what we call, and that is deep vein thrombosis, that is blood clot in the legs. So this was a challenge to us, because the surgery required a lot of I would say a complete setup where my cardiologist have to work on her, I have to do the surgery, my anesthetist have to do the right things, and it was what we say a combined effort of all the doctors. And I use so we worked her up, and yes, it was a high risk surgery, and what to do? We had to do the surgery, because if you want to see the patient walk, then we need to take the chance. So we went about and did the surgery. I was very happy with the surgery, and next day I made her stand, and next day and put her on a wheelchair, and everything went on well. And that is where the whole satisfaction of the surgery is. And she gradually improved. For me, most of the old patients, what I require is I want them to be independent. That's all I want. I want them to do their routine day-to-day activities, like going to the toilet, bathing themselves, sitting on a wheelchair, with minimal support for initially for few months. And that is my most important aim, and I think I achieved with her, with lot of comorbidities and challenges in that particular case especially. So, and finally I'm happy that she is up and about walking around, and I would say this is a success story of orthopedics, not rather than me, where we believe life is moment. And and actually I would actually congratulate the patient also, where the will to live is very important. Maybe I might do a very good surgery, but the will to live, that hunger to live, hunger to walk, that's most important, I would say.